A 72 years old man has been unwell for the many years. Following his death, a post-mortem is performed. Tissue is submitted for microscopic evaluation, and the evaluation of the section of the myocardium, it demonstrates there is evidence of the apple green birefringence with polarized light. What is the most likely diagnosis? So a patient, that means a 72 years old man suffering from disease many years, but after his death, postmortem done, and histopathological examination shows there is apple green birefringence with polarized light. So what is this? That means the apple green birefringence with polarized light, it is the diagnostic feature for which of the following disease. Here the options are the amyloidosis, SLE, that means systemic lupus erythematosus, tuberculosis, disseminated B-cell lymphoma, systemic sclerosis. First of all, let's see the amyloid. What is the amyloid? Amyloid is the extracellular protein deposit which is insoluble. So amyloid is a special type of the protein, and actually this is the abnormal protein. That means our body, it produces huge number of the protein in a day, but among them, some of them are protein are malstructure, or which is not the typical structure, which is the malformation, and this type of malformation is known as the amyloid. And despite disruption normal tissue structure, that means this amyloid, they are different from the normal protein structure, and all type of the amyloid consist of major fibrillar protein. So this point is very important, that amyloid, they are formed by the major fibrillar protein. Amyloid is classified with a prefix A, which is the amyloid, and a suffix. The clinical type of the amyloid, they are the AA and AL amyloidosis. So these two important type, one is the AA, another one is the AL amyloidosis. Systemic AA amyloidosis, it is found in the following pathological condition, and it has the long-term complication of several chronic inflammatory diseases, and these chronic inflammatory diseases, they are the rheumatoid arthritis, ankylosing spondylitis, Crohn's disease, malignancy, and the condition predisposing to the recurrent infection. That means in case of the chronic infection, there is a risk of development of the AA amyloidosis. On the other hand, here we can see the AL amyloidosis. Then this AL amyloidosis, it results from the extracellular deposition of the fibril forming monoclonal immunoglobulin light chain. And the AL type of the amyloidosis, they are commonly found in the kidney and the heart. So in the kidney and the heart, they are the AL type of the amyloid. And the diagnosis is based on the surgical biopsy. Actually, first of all, the biopsy followed by the histopathological examination. And the histopathological examination, it demonstrates there is a birefringence under the polarized light. So under the polarized light, when there is the birefringence, it is the amyloid. Also, immunohistochemistry also can diagnose an subtype of this amyloid. And what is the treatment? Treatment is the underlying cause. So what is the amyloidosis, or where the amyloidosis found? Amyloidosis is found as a apple green birefringence with the polarized light. So what is it? It is the amyloidosis. Why amyloidosis? Because under the microscope, there is typical feature which is corresponding of the amyloidosis, which is the apple green birefringence with polarized light.